Well, thank you very much, Dr. Weintraub, and thank you again, everyone, for coming. Today, I'm going to take you into a journey, and in fact, Dr. Weintraub has already talked about it, but into a journey on how all started and how we really arrived to today and what are the next steps. So we'll first review one of the problems and then how to address it and how it led to the PICORI project, engaging stakeholders for patient-centered research agenda. And I'll describe today's agenda and the next steps. So chronic kidney disease is highly prevalent in the US and in Delaware, and you will hear this again by Dr. Shahinian and Dr. Swanson. 1 in 10 American adults have some level of chronic kidney disease. In Delaware, in 2013, more than 2,000 patients were in chronic renal replacement therapy for an incidence of almost 400 patients a year. Patients with chronic kidney disease have multiple comorbid conditions, leading them to see numerous specialists. And unfortunately, they experience a highly fragmented care with poor communication between primary care physician and specialist, poor communications between electronic health record systems, and a very high rate of hospitalizations. So in 2014, as Dr. Weintraub mentioned, we obtained a grant to start addressing the problem, and we proposed to link data for kidney care. Our objectives were first to develop models and methods for predicting hospital admission in patients with chronic kidney disease, with obviously the ultimate goal of preventing them, and also to assess the transitions of care of children with chronic kidney disease to adult care. So some of the data sources that I wanted to show you, first, we selected all the patients with kidney disease from the records of the patients with kidney disease from the primary practices of the Christian Care Medical Group. And we also selected the records of patients with chronic kidney disease from Nephrology Associates practice. Nephrology Associates is the largest practice in the state of Delaware, and they cover a really large portion of kidney care in the state of Delaware. And we also had the records of the Christian Care Transplantation Department. We also have Medicaid records for our patients for Medicaid. And we also have the records from the patients who transition, the children who transition from pediatric care to adult care. So all this forms the base of our registry. And with this, we linked all our data to the Christian Care Acute Care electronic health record to assess hospitalizations, because this is one of our aims. And as well as we are we are doing it, in fact, right now, we want to link our data to the records of United States Renal Disease System, which is a federally mandated registry for all patients in chronic in chronic replacement therapy in the US. So what can we do with this data? We will study trends at population level or practice level. We will understand the characteristics of our population at state and practice levels. We will build time series to examine the transition of care from child to adult care. We will predict hospitalizations. This is one of our main objectives. And we hope that all this will help the healthcare providers to make medical decisions. For example, intensify care if a patient has a high probability of being hospitalized. However, what else can we do? What else could be useful? What other data could we add? What other information do we need? And most importantly, how can this be helpful and useful for the patients and the healthcare providers? So that's when I realized that I knew what I wanted to do with this data. However, I didn't know what would be helpful for the patients and what would be helpful for the healthcare providers. So that led me to apply to the PICORI grant, as again Dr. Weintraub mentioned. PICORI is a patient-centered outcomes research institute. It is an independent non-profit organization. Its mission is to fund research that will provide patients, their caregivers, and clinicians with the evidence-based information needed to make better informed healthcare decisions. And PICORI is committed to continually seeking input from a broad range of stakeholders to guide its work. So in the spring of 2016, not very long ago, we obtained the Eugene Washington PICORI Engagement Award to engage stakeholders for a patient-centered research agenda for chronic kidney disease in Delaware. Our objectives, again, is to inform all stakeholders of the CKD registry project. That's what we are doing right now, to better understand which outcomes patients, physicians, other stakeholders are most interested in, and how the registry could be useful to them, and what additional data would be important. We want to teach academic and community investigators to conduct research and write grants together. We want also to discuss data security, privacy issues in the context of research projects, and we want to discuss this with the patients, our stakeholders, and registry sustainability for research. So what we will do, we have our first conference. This is our first step, and thank you again for being here. And today, we want to inform the stakeholders, again, on the CKD registry, on the state of chronic kidney disease in Delaware and nationally, on the issue of disparity in CKD, on patient-centered outcomes research and comparative effectiveness research in chronic kidney disease. And most importantly, we want to begin a conversation with patients, their caregivers, healthcare providers, and all other stakeholders about research questions and outcomes that are most important. We will have also a 6-week course for community academic research training, and a group of us are going to work together. And we'll have monthly work group meetings of stakeholders. And we will also reconvene a workshop in the spring of 2017 to finalize the ranking of questions and outcomes, and I'll talk about this a little later. And finally, we will have another conference, the number 2, in the fall of 2017. So we will keep you updated and posted on the date. So please, remember the conference. And that will be for information sharing and dissemination from the work groups. So what are we going to do today? We have been very lucky to gather a group of nationally and internationally known speakers to describe to us or to talk about surveillance of chronic kidney disease and end-stage renal in the US and in Delaware, and also to address the issue of disparity in chronic kidney disease. After the break, we'll have patients and parents of children with kidney disease who will share with us their perspective on chronic kidney disease. And finally, we will learn about using health IT to identify and manage CKD populations. Then we will have a working lunch. And we'll have lunch presentations, starting with, we will learn about population health management and what the effort that is conducted right now at Christiana Care. And then we will have 2 talks about research, why patient-centered outcomes matter, and most importantly, why community engagement is so important. Then we'll have a break, and then the work group sessions. So the objective of the work group sessions this afternoon is to identify research questions related to kidney disease and their associated outcomes that are most important for all of you. So for the patients and their caregivers, and also for all the other stakeholders. We want to have questions, what we would like to have is collect questions who are related to prevention, diagnosis, treatment of kidney disease and its complications. And this is the very first step of our 2-year Partners in Research program. You will find question cards in the folders. And for all of you who cannot be here this afternoon, please, if you have burning questions or if you think about something that you really want to be addressed or assessed, please write it on the question card. And we have Dropbox in the back for these question cards. You have a work group assignment on your badge for all of you who stay for the afternoon. And we will do also a ranking exercise in the afternoon, and that will be better explained by all the mediators that are in the room. So after the conference, all the questions that we have gathered today will be posted on the website. We will review them one by one by doing a thorough literature review to determine if the answers are already known. And we reconvene a workshop, as I mentioned before, of equal numbers of patients or caregivers, healthcare providers, researchers, administrators, to rank the remaining questions according to predetermined criteria. So we will select the questions that are not known, that will guide us in our research for chronic kidney disease and end-stage renal disease in Delaware. So the whole process will be entirely transparent. All the results of the ranking will be posted on the website, as well as the decisions about which questions to pursue. So please stay involved and visit our website. And I need to thank Tim Gibbs for putting together this website, delawareckd.org. And there is a little magnet in your folder to remind you of the website. And please visit it and register and let us know what you would like to do and partner with us. So finally, I would like to thank a lot of people. First, our leadership team, the leadership team for the PCORI grant, Nancy Scott, who is right there, John Smith, Shay Scott, Tim Gibbs, Heather Bittner-Fagan. All the bios of these very important people are in your folder. And also the leadership and the staff of the Value Institute has been extremely supportive. And again, I want to thank Lakia. She's not here yet, but when we see her, we will thank her even more. She really did miracles to organize this conference. Sarah Faye Heckler was also absolutely instrumental in organizing this conference. Unfortunately, she's not here today, but it's for a good reason because she's in her honeymoon. And Holly Archinol is our student intern, and she's been also fabulous in organizing this conference. She's in the back over there in the right corner. I'd like also to thank Kate Smith from the Academy of Medicine, who has helped so much, and some people from the Family Medicine Department, Nicole Harrington, Dina Shilsom, and Lim McCormick, who have been here early this morning to help with registration and who will be also here this afternoon to help with the workshop. So thank you so much. Just 1 second. I'd like to introduce Tim Gibbs, who is the director of the Delaware Academy of Medicine. And he is part of our leadership team, as you mentioned. And Tim will talk to us about issues related to CME, not issues, but what you need to do for CMEs. And also we'll introduce our next speakers. Thank you.
Good morning. So you know that little voice at the end of a commercial that talks real fast and gives you all those details? I'm going to be that, but slower. So Dr. Jurkovitz, thank you for the introduction. On behalf of the Board of Directors of the Academy and the Advisory Council of the Delaware Public Health Association, welcome to today's conference. We know that this is going to be the start of a great engagement that will, as Claudine says, span across a couple of years. That website is one of the places where we're counting on everyone getting involved and joining up. So I'm the Executive Director of the Academy DPHA, and one of the great things about this conference is that it really utilizes this intersection of population health and medicine, and we're very excited to be a part of it. So now the word about continuing medical education. So today's event is accredited for both AAFP prescribed credit and AMA PRA Category 1. For those of you who are seeking credit for attending today's conference, it is essential that you sign in out front and that we have your correct medical degree. I understand that many people came, they got their packet, they got their name tag, but didn't sign in. We have to have you sign in. This pertains to nurses as well, especially if you're going to be converting or submitting the AMA PRA Category 1 credits for nursing for nursing CE. If you're claiming AAFP prescribed credit, you'll be emailed a post-session evaluation form around the middle of next week. If you're claiming AMA PRA Category 1 credit, please look in your packet, and you'll be looking for a piece of paper that has a green banner across the top. It will give you the details about how you'll claim your CME. Again, you need to have that package, need to be signed in. Those directions for the AMA PRA Category 1 CME will tell you to go to a specific website and enter your email address. Many but not all qualifying attendee email addresses have been preloaded, and hence it's essential that we also have an accurate email address for you. If you are a non-medical attendee who wishes a general certificate of attendance, please write this email address down now, and it's mine. It's tgibbs, Gibbs, at delamed, DELAMED.org. Email me, and I will get you a certificate of attendance. Regarding disclosures, the members of the Planning Committee have nothing to disclose. The Planning Committee includes Dr. Jurkovitz, Dr. Heather Bittner-Fagan, Sarah Faye Heckler, Nancy Scott, Shay Scott, Joanne Smith, and myself. Of the presenters, Dr. Cruz disclosed that she receives a consulting fee from MITRE Corporation. She will review this at the beginning of her presentation. No other presenters have made any disclosures of conflict of interest at the time of the filing of their paperwork. If anything has changed, I'll ask that they kindly disclose at the beginning of their presentation. And now on to today's program.